Hello and welcome to Health and Lifestyle, where we are passionate about health matters. Are you concerned about your health or that of your loved ones? Would you like to adopt a healthy lifestyle? Well, this show is for you. Our health experts are on set to explain health conditions we or our loved ones might face. We also bring you real-life stories and the latest trends in healthcare. My name is Marie Yambo. We'd also like to hear from you. Do share your ideas and comments on our social media platforms at KBC Channel 1 and at Marie Yambo on X. Facebook is KBC Channel 1 TV. Now to our first show of the season. Welcome to the future of healthcare, where distance is no longer a barrier to quality medical care. Technology is bringing healthcare right at the comfort of your home through telemedicine. David's journey with telemedicine. I journey to Eldoret to witness how telemedicine is transforming healthcare services. Home lab testing offers a hassle-free solution to monitoring your health. But first, what is telemedicine? It is the use of telecommunication technology, that is ICT, to provide medical care remotely through video or voice call using a mobile app. Patients can receive diagnosis and treatment without the need for in-person visits to hospital. It is particularly valuable for patients in rural or underserved areas, those with mobility limitations, and individuals seeking convenient and timely access to medical expertise. To learn more about telemedicine, I paid a visit to a telemedicine healthcare provider. Dr. Martin Macau is a director at HealthX Africa. He explains how this technology works. Take a listen.
By telemedicine, I just mean using telecommunications. This is either video or voice, phone calls basically, to attend to patients. So you make sure that you do it properly, establish what it is that you can deal with over the phone or over a video call, and have very clear guidelines over what probably needs referral to mainstream services, and then you treat patients using these telemedicine platforms that we have. So just to show what will happen, as a patient, you'll come, you'll have your measurements taken. Immediately you have your measurements taken, they'll be transmitted into this gadget via Bluetooth. Then they'll be sent to our center in Nairobi, where the doctor will see them. So what will happen is that the CHP or the nurse or whoever is assisting you, and if the patient is well versed with this technology, they can do it themselves, you'll call the doctor. And it'll ask you to accept the terms and conditions, and once you continue, select a language, and it will call our call center right here in Gigiri.
Okay, thank you much for calling Altex. My name is Paul. How may I help you?
Hi, Paul. Please patch me through to the doctor.
Okay, thank you. Could you hold on to the line, please?
So that's the care coordinator who receives the call, assesses the need, and sees who is going to refer you to. Hello, Dr. Kavenge.
Yes.
How are you today?
I'm good, thank you. How may I help you today?
Yeah, I'm with the media team, the KBC team. Yeah, just demonstrating to them how this works and how we can connect to a doctor from wherever we are.
All right.
All right, thank you very much. Have a good one.
You're welcome.
All right. Yeah, we have a full consultation with the doctor. Remember, they already have my measurements, my blood pressure, my temperature, etc., so they can see that. We'll have a full consultation, and after that, they'll either recommend medication, which they can now send to the device. Normally, we usually have a printer for patients who don't have email access or WhatsApp access. But those who do, the prescriptions will just be sent directly to their phones. Yeah. So places where we've set this and it's worked, factories where you have factory workers, we've also set it in some county hospitals, just to help decongest the queues there, because not all patients need to queue and wait to see the doctor. Some of them can actually be sorted by telemedicine and go home happy. And most of them are very happy. Another place we're setting this up is schools, because instead of schools sending the child away or keeping a sick child who they're not really sure how sick the child is, we can actually just manage. We operate a 24-hour service, working 7 days a week, meaning day and night, be it Christmas, be it New Year, public holidays. You can access a doctor And on appointment, you can access a psychologist or a nutritionist. As a patient, you might not tell this, but normally in the first few minutes of a conversation with the doctor is just assessing to see if your condition is one that can be treated over the phone, or if it's a condition that needs to be referred to a physical facility. So we're very careful with that. Safety and security, the patient safety and security is top on our minds, just as much as quality. So we usually make sure that we rule out anything that needs a referral or a physical attendance. You know, like for example, if you need a wound to be cleaned, we really can't do that over the phone right now. To put it simply, anything that can be treated in an outpatient that is not surgical in nature, we will probably manage it over the phone. This goes from conditions like coughs and colds, conditions like diarrhea, a lot of childhood conditions, headaches, fevers, and even chronic conditions like diabetes, hypertension. Not all of them, but those ones that can be managed in a primary care setting. You actually find that some of them have better outcomes in telemedicine, because in telemedicine I can talk to you more often than when it comes to the traditional mode of care, where you can only come in touch with me when you come to physically see me. But telemedicine, I can actually follow you all through the day, all through the week, just to know how you're doing.
Our next destination is Eldoret, where I visited the home of David Magomere, who has embraced the convenience and efficiency of telemedicine in managing his healthcare needs. David found traditional doctor visits cumbersome and time-consuming. However, since discovering telemedicine, David says his experience has been transformed. David Magomere, he is one of the beneficiaries of the digital health platform, and I'm here to understand how the services work right at the comfort of his home.
Welcome.
How are you?
I'm fine, Mari. Welcome.
Asante sana. And I think for me, I just want to understand, how long have you used the digital health platform?
It is now approximately 1 month ago since I joined the online health service.
Oh, okay.
Yes.
So it's just been about a month of using the services.
The service, yes.
Okay. And so far, what are you? How do you find it? How do you find the digital health?
I'm really embracing it, because I can say I can communicate to the doctors anytime you feel like you can communicate to the doctor.
Okay.
Yeah.
Wait, when you say you can communicate to the doctor anytime, does it mean that this digital health platform is like the health platform? Can I say is like 24 hours anytime of the day?
Exactly, 24 hours. Yes. As long as you are feeling unwell, you are free to call and explain to the doctor how you are feeling.
Most Kenyans believe that if you're sick, you're supposed to go and see the doctor, you know, at the hospital and be treated right there. But how did you find yourself using the digital health platform?
These services is not very much common. It's only when I had gone for medical checkup, I discovered that they had opened an office there. And the clerks at the referral hospital allowed me to go and talk to them. After talking to them, they felt that it is my option, either to use them or the ordinary way. And I preferred them because of my notion that I'll be talking directly to a doctor. While this one, I felt you have to consult the clinic officers first.
What are some of the health issues, if you don't mind, that you can make us understand that you had been, concerned about, that made you now go to hospital?
I have high blood pressure, which has taken me since from 2010. Then about 2 years, I have had some problems around my heart and the back. So I've been using these clinics, private clinics, but this time I just decided now to go to the government because I'm using NHIF.
I don't know how this digital platform has worked for you in as far as, say, money or economically.
Yes, it is somehow economical because you don't travel. And sometimes, Kenyans, in most cases, because of traveling, people find it very difficult to go to the doctor, and they opt to just go to the over-the-counter drugs. They just pick them and start taking them. They rush to a chemist, they have had somebody using a particular drug, they just go and ask for it, they continue taking. But with the online platform, I think that will be gone case, because you have to talk to a doctor who will prescribe for
How then would you talk about the time frame of being able to see a doctor? Because sometimes when you go to hospital, then you have to go through the processes before you see the doctor. I don't know what your experience has been for this whole month when you're seeking your services through the online platform.
time saving, because when you go there, even particularly when I was referred to the clinic again, I'm to call the clinic officer in charge of the online service referral, and he makes me the arrangement. So when I reach there, things are already through. Mine is to see the doctor.
And what do you like most about the online or the digital health services?
Anytime I can complain to the doctor. That makes me feel that is it's just like having a doctor with me.
Okay.
It's just a doctor in the house.
Oh, okay. Well, that's quite interesting. So having a doctor right in the house.
In the house.
Oh,
Yes.
okay. Yeah, and probably you'll be able to get you talking to one of your doctors and seeing how the process goes on. But
Yes.
again, people want to understand, how much does it cost to call this doctor when?
It is free. There is a line that is free, and if you have a smartphone, there is an application. It is called Health X Africa. It is in the Play Store. You download, then on that application you can use it to call.
No, okay.
It is free. Or if not, even if you call the other line, it is toll free. Yeah.
Imagine no longer having to navigate traffic or wait in crowded waiting rooms for a simple blood test. With remote lab testing, patients can now enjoy the ease and comfort of having tests done from the convenience of their own home. It is also enhancing the work of lab technologists. Joel Batts is one such lab technologist. We caught up with him as he visited one of his clients in Eldoret town. Joel Batts is one such lab technologist. We caught up with him as he visited one of his clients in Eldoret town, armed with his equipment, which includes a cooler box to ensure the samples he gets do not get contaminated, gloves and syringes. Joel arrives at Ruth Mutuku's home. He's here to draw some blood samples for further tests as directed by Ruth's doctor. For Ruth, having her samples taken from home was a new experience.
It began, I was sick, went to a normal hospital, they did some tests, and when the tests came out, they needed further tests, so the hospital could not offer that to me. So when I went to my doctor, is now when he referred me. He told me, I will come where you live. It was a bit shocking because I thought I was booking an appointment for me to go there.
Unlike the long queues that characterize health facilities, Ruth says the home services are convenient.
It saves you transport, saves you time. He'll come take the samples at your comfort. You're comfortable, even if you will scream if it's painful. You're comfortable. And then I loved the follow-up. They call you, they tell you the results will take, if it's 2 weeks or 3 weeks.
An elderly patient will wait for 3 hours just to take their sample. They could have taken 30 minutes to collect sample, the result will be out in an hour time.
After getting the samples, Joel heads back to his lab to conduct further tests.
So this is where I receive my samples from home collection. This is where the first place I enter. First I check the condition of the sample that I've brought in, if it is in good condition. It is not hemolyzed. The sample is okay. I had put the barcode already earlier. So I collect the 2 samples from the patient. So there's a kind of samples that I've brought in. And as you can see, in my box, it has a ice pack. The ice pack keeps the box at 2 to 8 degrees. Because if you transport samples at a temperature above that, the samples may hemolyze or they cannot, the taste that they go around, they degenerate. So this kind of temperature that these kind of samples are being transported. Any sample need to be transported between the temperature of 2 to 8 for longer storages.
Some samples, he says, may need sophisticated equipment, thus must be transported. However, Joel cautions that while technology has brought convenience, not all lab tests can be conducted at home.
Yeah, there are those tests that are more sophisticated. They cannot taken from home. Like maybe, for example, you're taking maybe an FNA sample, which is ultrasound guided, which is also done by a doctor, trained doctor. Patient will have to go to a hospital, then sample will be taken from there. So those are, and tissue samples, biopsies, they cannot be taken from home. You must go to a theater.
Privacy, he says, is key to boosting patients' confidence.
So when I'm done with the test, I'll just phone the doctor and tell the doctor, the result for your client are ready. I have sent you a copy on your email, and another copy I've sent the client. But there are those results that are confidential, like HIV tests. HIV tests are not actually emailed to the patient directly. They are better emailed to the doctor. Then the doctor will discuss the results to you. So that's kind of, so you'll get a call from your doctor that I've received your result. Please come for interpretation, or the doctor will interpret to you on phone. Or you take, if you have the result, you take your results to the doctor interpret to you, and then you get your results there and prescription.
Joel encourages particularly those with babies or handicapped to embrace the services.
Infants and those people who are people with disabilities, yeah, maybe a person is moving on a wheelchair, they will prefer taken from their office or their home than moving in town with a wheelchair looking for a lab, you see. So those are the kind, and the infants, you know, people don't like their babies being exposed to a lot of things. So you can go and take a sample from a baby, the comfort of their bed, you run the result and return them the results. Yeah.
Curious about people's take on telemedicine, we asked them their opinion on telemedicine on Word on the Streets. Let's listen to their reaction.
I'm Clever Songai, and then I'd like to answer the question. I will not accept or I will not agree to be prescribed medicine by an online doctor, because some signs and symptoms you have to visit the clinic or the health practitioner in order to be prescribed the correct medication of whatever you're getting healed or curing from.
Oh, my name is Ruth Munini, and the reason I can't allow to be treated by an online doctor is that I might not be sure if he's a quack or a scammer. Yeah.
One of the greatest revolutions that we've had on this particular century is technology. So for me, I'll advocate most people to be able to have the interaction whereby you can be able to call a doctor from your convenience, from your comfort, so that you can be able to be assisted rather than going to the hospital physically and getting long queues.
By enabling remote consultation with the doctor, telemedicine cuts down on transportation costs and the time spent traveling to healthcare facilities, thus reducing the cost of healthcare. It also provides services to remote areas where access to medical services is limited. Roy Bore is the CEO, HealthX Africa. He explains the role of telemedicine in terms of improving access and affordability.
Yeah, technology has really evolved, and the space of digital solutions in healthcare has really evolved and become quite paramount. You think of the healthcare space in Africa and sub-Saharan Africa, there's no way we will solve our challenges without deploying technology. And before I answer your question, really is to describe what is the problem, what are we trying to sort out. So number one, there's huge deficiencies in access to healthcare in Kenya. The average distance to a medical facility is 5 kilometers, meaning nobody can just leave their house to access a facility where they can get medical services. It's a big challenge. The second thing is an issue around affordability. 25% is the penetration of both national and private insurance. When you compare it to GDP, it's only 3%, meaning 97% of our people lack access to healthcare through insurance, meaning the question of affordability is quite paramount. Through technology, we can be able to bring that cost significantly down. So that's the problem we're trying to solve. And how do we do this? Through our offices here, we run a digital operations center. Think of a call center full of doctors where they're able to answer calls or give consultations for people across the country. How do Kenyans access this service? Number one is through an app available both on Android and Apple. But 80% of our callers interact with us through a toll-free number because you don't need internet, you don't need data, you don't need airtime. You just call and we take care of the bill. Then you consult with our doctors. So we are addressing that challenge of people having to leave their houses to go to a medical facility, as I mentioned, they are far. You are addressing the challenge of affordability because our fee is quite affordable compared to traditional access to healthcare. So we are solving that challenge. We are plugging a gap. We have to work with government in the spirit of universal healthcare. And we have integrated with various partners such that you call us from your house, you do the consultation. If you need medication, it's sent to your house through our partners. If the doctor sees that you need additional tests, blood work, we send what we call a phlebotomist to your house. They draw blood, they get it tested through, of course, fully certified laboratories. Then the results are relayed to us. We call the patient, sitting in the comfort of their home, to relay the results, and again, medication is delivered. So when you think of someone with a physical disability, the matatu or the public transport system does not take care of them. By integrating with the CHP program, we are able to strengthen the role of CHPs by providing them with the technology. We have seen the government giving them phones. Why can't we have technology or app or a way for these CHPs to escalate immediately? You know, currently they would have to refer them to a sub-county hospital, a county referral hospital. And again, I mentioned the challenge of distance. And the other factor I didn't mention is that 28% of the time, there's absenteeism of a medical doctor. So even if you refer them, they might not find a doctor. So why can't we connect this CHP direct to a doctor, fully qualified doctor, registered by KMPDC, ready to serve at that point? You know, in healthcare, intervention needs to be timely for it to make sense. That's why we feel telemedicine has a strong role in promoting UHC by strengthening the role of CHPs, by providing access to quality healthcare, which is affordable to persons living with disability, while still ensuring that government achieves its agenda. And we are here to support.
And to a good practice segment, we give you tips on how to improve your overall well-being. Fatma Mohammed is a nutritionist and a wellness coach.
Today we're going to focus on hydration. Hydration is important because it's going to help you in cooling your body, lubricating your joints, maintaining your body's temperature, and most importantly, detoxifying your body. So if you look outside, you'll find that the weather keeps changing. It might be hot or cold, but during hot weather, you're more likely to hydrate. But it's also equally important for you to hydrate during cold weather. This is when you're not likely to feel thirsty, but hydration is also very important. So how exactly can you boost your hydration? Step 1, you're going to drink more water. You'll drink about 2 to 2.5 liters of water a day, and you can squeeze half a lemon to about 500 ml of water, or you can add lemon slices to your glass of water. Secondly, you can eat fruit and vegetables with the highest water content. For instance, you can add more watermelons, you can add cucumbers, mangoes, and also you can add pineapples to your diet. You can chop them up into a big salad, you can carry this to work, and you can also give it to your kids as they're going to school. Especially for the kids, they're going to enjoy it if you add a spoonful of honey or you add a spoonful of peanut butter. So this is one of the best ways for you to hydrate and take care of your body.
Well, that does it for the show. On behalf of everyone who made this show possible, thank you for tuning in. Appreciations to David Magomere and also Ruth for taking the time and sharing their experience with us on telemedicine, HealthX Africa for the insightful information about telemedicine, and of course you for participating in this show. Remember, we would also like to hear from you. Head to our social media platforms at KBC Channel 1 at Marie Yambo on X. Our KBC YouTube channel is also up. You can also give us your comments on the topics you'd want us to share in this program. So until next time, my name is Marie Yambo and hope to see you again next time.